from all of you. Is it, are you all from the healthcare background or are you from different backgrounds? Different backgrounds. So you some are from finance, some are from uh, probably HR, marketing, telecom. Oh, that's good. Okay, so before going into detail, we just have to understand what is the definition of healthcare sector and why there is a specialized need for people to get, or for the more people to join the healthcare sector, and moreover, why many new roles are coming up in the healthcare sector. So what's this new trend coming up? Previously, when we used to think about healthcare, is that there used to be a doctor or general physician or any specialist, or even prior to the earlier times, there was just going any healthcare practitioner or tabib or vaid. So yes, they used to give the medicine, or they used to prescribe any treatment plan, and the patient will take the treatment. Then they will take it, and after that, they will uh, get the desired outcome. But why the healthcare industry is going for rapid change, and what is the need for those type of
हाँ हाँ
specialized
बहुत सही
professionals?
करते हैं और रोज करते हैं
Okay, so for that, first we have
रोज
to understand the real definition of healthcare sector. Okay, so the first and foremost thing, if
कैसे
you
है आता है
hello. Okay, so the first and foremost thing is that we have to understand the definition of healthcare sector. Uh, so in a brief, the healthcare sector is a business or entity or organization that provide medical services. So what is it? What is this medical services? It's a patient service, the treatment, the surgery, whatever it is. Then they manufacture medical equipments like biomedical equipments, or MRI, CT scan, the large medical equipments, or kind of patient care equipments like BP machines or sugar machines. Apart from that, they even are responsible for manufacturing drugs and medicines. Then it also includes the medical insurance and any other facilities, like there is a new trend coming up, kind of auxiliary healthcare services. In the auxiliary healthcare services, these are the services which do provide support services to this to these hospitals or healthcare institutions. So in a short, the major role of healthcare sector is to encapsulate or provide a complete big tent of all services that a patient will take whenever he needs a treatment, or whenever he needs any diagnosis, or whenever he have to improve his health. So a healthcare sector is not just responsible for treating, but the real healthcare sector starts from diagnosis, prevention, treatment, surgery, and as well as post rehabilitation. So as and when the industry is expanding, so this industry is calling for more specialized professionals. So these more specialized professionals, it's no, this industry is not just calling for the professionals from the basic medical industry, but it needs the professionals from other spheres like IT, from marketing, from finance, from operations, even from uh, like general administration facilities. So in short, as and when the diseases are coming up, as and when the patient or the people what you say, that new innovations are coming up, so there is a need for more specialized professionals. Okay, for that, first we have to understand the, why it do matters for the more specialized healthcare industry, and why there is need for the more healthcare professionals. There are three major conditions. The first is the population growth, the second is the aging population, third is multiple conditions like there are many people who have comorbidities, multimorbidities. So it do requires more specialized healthcare services. So the first need is population growth. Previously, if you see the data, the population is constantly increasing. Uh, if you see almost 50 years back or 100 years back, the world population was around 5 to 6 billion, but now it's coming around 8 billion. So there is a huge increase of the population. The second is the aging population. So as and when the people ages, there is a need, or there is a general tendency to for the or uh, as and when the people ages, the human body, because of multiple changes in the DNA or in the in the body metabolism process, there might be a lot of diseases. The third is multiple conditions like because of environment, because of your food habits, because of your other factors like stress or some chemical exposure or some type of drug exposure. So all those conditions are giving rise to many diseases. So furthermore, Thi- this made the healthcare professionals to come up with the new medicines and devices. So these new medicines and devices, it could be like uh, more specialized diagnostic medicines like more specialized CT scans, more specialized diagnostic tests like you can say uh, more specialized biochemistry and biotechnology tests. Apart from that, as and when the diseases are coming up, the scientists are coming up with new type of medicines. Apart from that, there is a new trend coming up of personalized treatments, whereby previously the doctors used to give a generalized treatment, but as and when the new diseases are coming up and uh, uh, as and when the new diseases are coming up, and moreover to combat uh, what you say various type of comorbidities or multimorbidities, the doctors are uh, coming up with personalized approach. Apart from that, um, moreover, the patients or what you say, uh, even the patients and the hospitals are coming up with better integrated care, whereby most of the patients, they are expecting that whenever they have any type of symptoms or any type of disease, they want a common platform whereby they will get the complete treatment plan and right from diagnostics till uh, medicine to surgery and post rehabilitation. They want a complete package. Apart from that, uh, the healthcare professionals, they are partnering with software engineers or IT professionals to come up with more specialized technology to diagnose various health conditions. And apart from that, they want to improve the patient treatment outcomes by integrating various technologies. So for that, before going into details about alternate healthcare carriers, first we have to understand the various stakeholders in the healthcare industry. So, and mostly when you used to think about the healthcare industry, we usually think that healthcare is just confined to a hospital or to a clinic, but there are various stakeholders in the healthcare industry. If you see, the foremost stakeholders are the hospitals, the clinics. But to support the entire ecosystem, we need various uh, various players. Okay, so every player have a different responsibility. The hospitals, the responsibility is to treat the patient, and if there is a need, then to perform the surgery. And so the ultimate goal of any hospital or any clinic is to treat the patients. So the government hospitals, they are run by a public institution or a grant. The multi-specialty hospitals, these are the hospitals which is run by private players. and they have various specialties under one roof. The super specialty hospitals, these are the hospitals which to provide various specialized treatments, like they have very specialized doctors, like let's say for example oncology or radiation oncology. Then apart from that, there are teaching hospitals, medical colleges. So these are the hospitals, they do conduct research. Apart from that, they are even responsible for training doctors. So every country they have a different ecosystem. In India, uh, mostly as an for taking up any medical education, the student will take after the 10 plus 2, they will go for MBBS. In the countries like USA and Canada, the students will take up first a bachelor's degree, then after that they will go for MD, then after that they will go for various residencies. So these are the primary players in the healthcare ecosystem. But to support the entire ecosystem, we need various players. Okay, there are a few hospitals. These are the rural hospitals. So to support the people in uh, like remote places, the government and various uh, NGOs, they come up with the rural hospitals. So these rural hospitals, they provide the first care of treatment, and mostly these rural hospitals, they will closely work along with public health professionals and various specialist doctors, and for the patients who reside in the rural areas, they give the immediate treatment. Apart from that, there are multi-specialty clinics. So these multi-specialty clinics, or sometimes they even work as daycare center or daycare surgery centers. And some multi-specialty clinics, they just provide they just have only consultants and general physicians and few specialists, but they don't admit the patient, um, and they will just provide the consultation. Few multi-specialty clinics, they do admit the patient, but for a special for a day. Then apart from that, there are small private hospitals. They're kind of single specialty hospitals. Let's say there might be a small private hospitals which do specialize only in the ortho, and there are some small private hospitals which do specialize only in gynec case. So these are the kind of support, or they provide the additional support to the major stakeholders. Then apart from that, there are rehabilitation clinics. So these rehabilitation clinics, they are kind of subsidiary of the major the primary stakeholders. uh, the- there might be a lot of cases for the rehabilitation. So let's say the person, after undergoing a major surgery or after undergoing a major accident, or even like paralysis, so they have to undergo few rehabilitation. So these rehabilitation clinics, they provide the patient post surgery care or post trauma care. So these are the essential stakeholder of the healthcare industry. Furthermore, to support the healthcare ecosystem, there are the third layer. The third layer is the primary healthcare, the diagnosis center, the general practitioner, the pharmacies, and the blood banks. So the primary healthcare. So the primary healthcare is their major responsibility is to prevent the disease, and they mostly work along with doctors and healthcare practitioners to prevent the disease, to carry out the vaccination plans of the various governments. And furthermore, they do conduct various tests, and if there is any epidemiology or any disease breakout, so they will educate the patients or the general population. So the ultimate goal of the primary healthcare center is to provide the first line of treatment, and moreover to prevent the disease. Then apart from that, there is another important stakeholders, the diagnosis centers. So these diagnosis centers, they will carry out various tests and various radiology and pathology and medical biochemistry, biotechnology tests. So uh, they're the essential partner in diagnosing various diseases. Apart from that, there are a lot of general practitioners. So general practitioners, they are the people who do provide the general who do give various if a person has a generic or various basic diseases, so these are the these general practitioners give the first line of treatment. Apart from that, there are pharmacies. The pharmacies, yes, they mostly we think that pharmacy is just responsible for dispensing of the medicines, but the role of pharmacy is not just of dispensing medicine, but they are even responsible for giving the complete or even educating the patients on the various medicines, and they are even responsible for having a look at the patient prescription to see if the patient has any morbidities or comorbidities, and whether his vital parameters are right or wrong, and whether the particular medicine will have any interaction. So these pharmacists, they are responsible for understanding the various to understand the patient case history, and prescribe the medicine or give the medicine, and even educate the patient on the usage of these medicines. And one of the most integral part of the healthcare ecosystem is the blood banks. So the blood bank, obviously, you all know that they do store the blood, and if there is any need for the surgery or for any trauma, so they provide blood to these stakeholders. Apart from that, to run this the entire ecosystem, there are two plates which don't directly fall in the ecosystem, but they are part of it. The first player is the insurance providers. So these insurance providers, they they help the patient, or like they will make sure the patient, if there is a need, so they will provide the insurance. And apart from that, they will closely work along with doctors and various other healthcare providers in releasing of the fund, because for getting any treatment, we all need we all need finances. So for these finances, these insurance providers, they do fund your finances. So the insurance providers, they are, though they are not the integral part of the healthcare ecosystem, but they uh, when there is any need, they make sure the patient is getting, or the patient is being financed properly for getting his treatment done. So the insurance can be the private insurance, or the government insurance. The private insurance can be like any major insurance like ANB or Bajaj Allianz. Then apart from that, there are various government insurances like the US government insurance, and even Indian government have various insurance, or uh, I I can't able to, in the Telangana, in the government of Telangana, we have various government government sponsored insurances. Apart from that, to run the entire ecosystem, the government form a body. So this body, they will regulate whether these hospitals and the entire healthcare ecosystem is functioning properly or not. So there are various regulators, and they will constantly monitor these hospitals, and as well as this healthcare providers. So let's for the medical colleges, the government had a regulator known as National Medical Council, NMC. So they will maintain all the licenses, and they will periodically check various various teaching hospitals. Apart from that, the government also had one regulator for the hospitals, NABH. So the NABH, they will make sure the hospital is maintaining the desired standards. Then uh, apart from that, there is NABL. So NABL constantly monitor or accredit various labs at diagnosis centers. Apart from that, um, worldwide there is another regulator known as JCI. So these regulators, they will make sure that hospitals are being run properly, and moreover, any person who is providing any type of healthcare services, whether it's doctor, whether it's pharmacist, whether it's anesthesia technician or radiology technician, whoever it is. So are they licensed or not? are they maintaining the licenses? Are they doing any fraudulent practices or not? And if they whether they are following the ethics or not. And moreover, if any of the healthcare provider, if they're not following any ethics, then these regulators, they have the power to cancel or to suspend the licenses for a certain amount of time. So these regulators, they are so much powerful that they can temporarily cancel or suspend the license of any doctor or healthcare practitioner or the entire hospital or an insurance company. So to run this entire ecosystem, we need various players, so that a patient or a person who is entering uh, who is entering in this ecosystem to get his disease treated, so that he's not being robbed of, and moreover his interests are being saved. So there might be cases that a patient is not operated properly, or moreover, a doctor is the doctor didn't follow the medical ethics. So in that case, the patient can approach these regulators, and these regulators, they will check, and if found guilty, then they will take the action against these providers. Now, mostly we think that the healthcare career is just limited to a pharmacist or to nurses or to doctors or this key stakeholders. But as I told you, that the healthcare industry is growing at a very rapid pace, and there's an integration of technology, there is integration of there is integration of computer engineering, there is integration of hardware engineering. So for that, there is a need for integrating or calling upon the specialized professionals from various industries in this healthcare industry. So this creates the pathway for various alternate career options. So in this webinar, we are going to discuss the various alternate career options in this healthcare industry. Okay, the first health career option which we are going to discuss is of the healthcare informatics. Uh, I might be sure, I'm quite sure that whenever you are visiting any doctor or any healthcare practitioner, the person will take your case history on a piece of paper. So this is general practice. And whenever he is taking any case history, uh, this case history, it will help him to understand various diseases which you might have, and furthermore various medicines which you might be taking, and other tests which you perform, and moreover your insurance provider. So all those things, uh, but it will be in a very disorganized format. Nowadays, many healthcare providers, they are using electronic medical records. So these electronic medical records, so this will give the doctors or the healthcare providers a central repository for storing uh, all the patient data. So whenever there is any need for pulling up all the data, the doctor or the healthcare professional can pull up all the data within a fraction of with a fraction of time. Furthermore, EHR records, and moreover the specialized medical records, this will help the doctors in the ER settings. So whenever a complex surgery, whenever a complex whenever the patient is admitted uh, for any symptoms, then a person treating the patient or for the healthcare professional treating the patient for any comorbidities or multimorbidities, so it might be very easy for him to fetch the data so that he can plan the things accordingly. So the end user of this EHR records or the electronic medical records, it could be like patients, or sorry, it could be doctors, it could be the nurses, it could be the administrators, and moreover it could be the clinical pharmacists. So whenever they have to take any data, so they will fetch the data and they can make accordingly the right decisions. Furthermore, this informatics, and there are few more innovations which is going on in the healthcare informatics. So there are many more softwares or many more technologies which come up in this segment. So the recent innovation, the recent tool which, or I can say, sorry, in the healthcare informatics, there is one more segment which which many doctors they are using is the clinical decision support system, CDSS. So this CDSS, they will help the doctors or the healthcare professionals in using the data and the technology to make the right predictions of the disease. So many doctors, there is one clear example of the dermatologist. They are using a tool known as Visual DX. So this tool, whenever if, probably you might visit any dermatologist. So a dermatologist, he usually uses dermatoscope uh, for diagnosing any skin condition. So now this particular tool, they will use the images of any skin condition, and it will help the doctor in matching this image to vast images of millions of images across the world, and it will help the doctor in clearly matching the disease image to the right image diagnosed by some other doctor. And moreover, it will help the doctor in making the right predictions, and moreover it will help the doctors in giving the right medications. The second alternate career, which you might uh, thought about is, or which you might heard about, is the genetic counseling. We might have seen a lot of our students or can you take a break for water? I'll just be back in a second. Okay, I'm very sorry. Now, apart from that, uh, there might be various yes. Okay, so as we were discussing about healthcare informatics, so now the next field which is really catching up is the genetic counseling. Mostly, we think that we can predict the disease right at the diagnosis stage, but the advancement in the healthcare industry or the healthcare science give rise to various specialized fields which will help the patients in understanding the probability of having a disease or having a certain condition much earlier than being predicted under various radiological tests or various pathological tests. So one such field is this advancement give rise to a field known as genetic counseling or genetic or DNA counseling. So many people to understand various risk factors or disease factors, they are they're taking up gene assessment or DNA assessment, and once the gene assessment or the DNA assessment is confirming of the gene assessment or DNA assessment is confirming the probability of having a certain disease. So just genetic counselor, they will help or they will counsel the patients or the family of various treatment options, and moreover, they will help the people in psychological aspect, and moreover, they will help the patient, or they will help the patients in prescribing various prevention plan. So let's say this gene counseling or this DNA assessment will help the patient in various disease planning. Like for mostly, it will help the patients or the individuals in understanding the risk of having certain cancers or Alzheimer's or various Down syndromes in the child. So once if the test confirm of having certain disease, so this genetic counselor, they have responsible for giving the psychological support. Then moreover, they will help to come up with the right insurance policies which will cover that particular disease. Moreover, they will give the proper understanding of various genetic testing. Apart from that, they will even give educate the patient on various treatment plans, the right doctors, and apart from that, even they will guide the right pathway to minimize the risk. Okay, the third career option which you might thought about is, or which you might heard about, is medical billing. You might have saw a lot of people uh, who are doing the job as medical billing or medical coding. So what exactly is this medical coding, and how this medical coding is related to the healthcare industry? So first and foremost, uh, definition of medical coder or the medical billing specialist is that this are the people, they're responsible for translating all the healthcare services into diagnostic codes for various healthcare providers. Um, like uh, uh, if a person has certain disease, so these coders, they will they will just write down the entire diagnostic reports in the particular coding system. So this coding system, which will help the insurance providers in um, better reimbursing the patient. So right now, the ICD, the International Classification of Disease, they have certain codes for various diseases, and these medical coders, they will write the appropriate codes for various diseases, and as and when the insurance providers, and not just insurance providers, even it's responsible for understanding not just in the not just the insurance providers, even it is okay. So it's not just the insurance providers, but even what you say, this course, it will be even forwarded to various specialist doctors or the pharmacist, and after that, when a it will help the healthcare providers in ensuring the patients are reimbursed properly. So these medical coders or the medical billing specialists, they are also one of the most integral part of the healthcare industry. Now, the fourth career, which is rapidly growing up, is the radiology technician and radiation therapist. Okay, whenever you might have a basic or a very minimal injury, or you might have certain type of disease, or you might have certain problems, so you will visit a diagnosis center, and for a bone related issues or soft tissues related issues, the doctor will prescribe a X-ray or CT scan or MRI or any other specialist test. So these radiology technicians, they are responsible for running these machines, and moreover, the educating the patients, and after that, they are responsible for generating the images, and they are responsible for processing the films. Furthermore, as and when the career is this persons when they are furthermore, as and when the person furthermore, as and when this special as and when the persons are going up the career, they can go for more specialized uh, career pathways. Like there is a new trend which is coming up known as radiation therapist. So this radiation therapist, they will work along with the radiation oncologist or radiation diagnostic or intervention radiologist in intervening various type of dyes for better diagnosis. So this radiation technology is not just responsible for creating the images, but they are even responsible for working along with radiology for uh, the diagnostic purpose and as well as the treatment purposes. So whether it's inducing various type of dyes, or whether it's working along with the radiologist in uh, carrying out the biopsy, or whatever it is, so they are one of the most integral part of the healthcare industry. Uh, okay. Apart from that, there are few more career options. Probably you might see a lot of people because of old age or because of certain medical conditions, they might have uh, hearing device in their ear, or uh, so we so this the fifth alternate career options which an individual can think about is the audiology and speech language pathology. So this audiologist, they will work along with patients and understanding the impact of any hearing, and after that based on certain results, they will prescribe the right audiometric device or the right hearing device. Furthermore, this audiologist, the responsibility is not just limited to prescribing the hearing devices. Furthermore, they will even closely work along with ENT specialists in giving the right counseling to the persons having cochlear implants. So the cochlear implants are, you can say, inbuilt hearing devices. So they will closely work along with ENT doctors in improving the hearing of any patients or any individuals. Furthermore, uh, this audiologist and speech language pathology, they are even responsible on on treating individuals who are having any speech language deformities. So they will work along with various type of individuals having speech language pathology by giving the right exercises or the right coaching. So they're one of the more they do they're also one of the most integral part of the healthcare ecosystem. Apart from that, there are many cases where many head of the states or head of the governments, they took the services of speech language pathologists to improve their hearing abilities. One such example was uh, uh, the King William George Fifth, who took the help of a speech language pathology, and he had a stammering problem. And after taking up the speech language pathologist treatment, he delivered the most passionate speech during the World War II. Apart from that, there are various other alternate career options which individual can think about, both clinical and as well as non-clinical. If you're thinking about clinical healthcare options, you can think about phlebotomist. You can think phlebotomists are the individuals who are responsible for drawing up the blood, and after that, once they draw up the blood, then they have to follow certain codes of uh, they have to follow certain codes, and after that they have to process the blood for various testing. Then there is if you're looking for non-healthcare career options, then you can think about healthcare administrator, or you can think about public health as one of the career option. So, okay, now comes the most important option, or now comes the most important thing of, can a person from a non-clinical background enter into the healthcare industry? Yes, they can very well enter into the into healthcare industry. There are many cases a person from a non-clinical background entering into the healthcare industry. If you see, the big healthcare technology companies like Tacto, 1mg, they have various technologies. They have various specialized software engineers who are developing or who are building up softwares for the healthcare ecosystems. As a just now I told you one clear cut example of integrating the patient diagnostics in the healthcare ecosystem of by using very specialized software for diagnosing skin conditions, visual DX. So there are various cases where the where the non-clinical or the non-healthcare people making a career switch into the healthcare industry. Furthermore, one can also get into the healthcare industry by pursuing certain certifications. If you are planning to make up a career in health informatics, then there are certain certifications from certain bodies like CAHIMS. They have a certificate known as Healthcare Technology Specialist, that is HTSC. There are a few more certifications like a registered health information technician. So these are the technicians. They are responsible for managing the electronic medical records. Furthermore, if you are end user, or if you have good knowledge of uh, managing the healthcare technology, then you can take up a career in managing the EMR records. And if at all, if you are looking for the very basic certificate in the healthcare informatics, then most the most entry level certificate in the healthcare informatics, or if you're looking just to make inroads in the healthcare industry, then you can take up or you can take up this certificate, that is certified associate in health information and management systems. So if you're looking for an entry pathway from a non-clinical background, and if you are not looking for the administrative levels post, but you just want very basic desk level job, this is the most entry level certificate, and having this certificate will open the lot of pathways for you in the healthcare industry. Now comes the most important aspect of having the global approach. So now, mostly the countries like USA, UK, Australia, and Canada, and even the Gulf nations, they are adopting, or they are coming up, or they do follow a lot of international standards, and they so just a second. So they follow a lot of international standards. So having this type of advanced certificates in the healthcare management or healthcare technology, it will give you, or it will open the pathways for you to in having a career in the healthcare industry. Furthermore, if you're looking for administrative level jobs in the healthcare industry, so having good operations level skills will help you in uh, uh, good operations level skills and good patient management level skills, good customer service skills, then it will open the pathways for you to have a good career in the administration domain. So one of the basic jobs of healthcare administrator is that they are not just responsible for maintaining the hospital, but they are even responsible for maintaining the rosters of the doctors. They're planning their surgeries, and moreover, maintaining the HR ecosystem. And apart from that, they are responsible for what you say, maintaining or improving the patient treatment outcomes. There is one more career option which it is quite or you can say which is quite catching up. It is known as biomedical technician or biomedical engineer. So if any individual with deep interest in the instrumentation domain and the health industry domain, he can take up a career in the biomedical industry. And biomedical industry is one of the fastest growing industry, and major biomedical companies like Philips Respironics, GE, Siemens, they are constantly innovating to come up with various designs, to come up with tools, specialized tools to predict and to manage various diseases. So if you are a person with interest in health, in the administration or operations or marketing, you can easily take up a career in the healthcare industry, and you can really make wonders, because healthcare industry is one of the fastest growing industry, and it's one of the I can say it's the largest industry, and there is still room for more individuals. And if you have if you become a specialized, then the sky is the limit for you. So any questions for? Do you have any questions? Or should we?
Hello.
Hello, does anybody have any questions?
Yes. Hello.
Yes, hello, tell me. Hello. 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 Okay, this, if anybody have any questions, you can reach out to me on directly on my. Okay. Yes, tell me, do you have any questions?
Yes, I do have a question.
Yes, tell me.
I'm very much interested for the healthcare, but then I don't know how to register. Can you please guide me through?
Okay, what's your background?
Basically, I'm from the hospitality industry, but then not related to the healthcare, but
Mhm.
then the hotel industry.
Okay, and what's your interest area? Like you are looking
Health
for?
caregiver.
No, no, I mean, you're looking for the clinical side, you're looking for the marketing side, or the insurance
No,
side,
attending the patient.
attending the patients.
Yeah,
Okay,
giving the care job.
okay, as you are from the hospitality background, and as you have more interested towards in the healthcare ecosystem, so
Right.
there are couple of short-term courses in the healthcare administration
Okay.
of 5 to 6 months. So you
Okay.
can easily transfer your skills in the hospitality and guest relations in the healthcare domain. Uh,
Right.
one of the key aspect of the healthcare administration is that you have to understand that patients, they are very restless, and they
Right.
want a very supportive care. And if
Right.
a person is able to do that, then he can
Okay.
become a good healthcare administrator.
Right. Right.
Apart from that, the healthcare administrator is not just responsible for the patient care, but
Right.
even responsible for maintaining the different stakeholders. As I told you, different stakeholders like the
Right.
insurance providers, the pharmacies,
Right.
the blood banks. So you have to take you have to support each and every stakeholders.
Right. Let me tell you something about that. As I have been already doing this from past 3 4 years. I'm
Mhm.
attending my uncle. He has Alzheimer, and his age is 84 years. So I'm already into it. I'm giving the care job, and I wanted to know like how to get registered in this industry, so that if I can see that lot many requirements are coming these days for European countries.
Yes. Okay, so as you told that you attended a patient having Alzheimer's, so there's one such carrier which is quite coming up. It's known as
Right.
career carrier.
Career.
Yes.
Indeed, this is the one I'm looking forward for.
Okay, so career for that there are few basic level certifications. So the career is again when it comes to career carriers, there are many more specialties like palliative care and
Mhm.
geriatric cares and
Right.
post rehabilitation care. So once based on the job requirements, one have to customize their CV.
Indeed, I'm very much efficient doing that. But
Okay.
then the only concern is I just wanted to get it certified so that I can get one certificate from somewhere, wherein if required, I can do 3 4 months, 5 6 months course if it is available.
Okay.
And I just wanted your favor in this is that can you please give me some links or some websites or anything
Okay, I
wherein.
will. We have certain certifications uh, from various bodies, so I will
Yeah.
definitely look into it.
So
Okay.
how do I get that links from you? Are you
Okay.
going to send it through
You,
the you type in and send it to me,
no, after
or
the session, you just drop me a text.
I drop you a text at the same application where I'm on Zoom itself?
Okay, I will just share the number with you.
Okay. Do I share my number with you
I'm
now?
going to share my number with you.
Okay, please do that so that I can log into it and I can drop you through WhatsApp. I can send you my
Okay. Mr.
details
Shafat
required.
told me, asked me that how about the career opportunities as EMR specialist in Gulf? Yes, there is huge requirement for EMR specialist in the
Oh,
Gulf.
Okay.
And as I told you that every large healthcare organizations or the hospitals, they are using EMR platforms. Gone are the days where the doctors, they just used to take up take the diagnosis over the piece of paper. Now,
Okay.
healthcare providers, they want each and everything in a central repository. That they even want the same
Exactly.
records. It should be carry forward to the pharmacies and
Mm.
to various other clinics, so that if there is a need to consult a different specialist doctor or different doctor, the patient data can be easily pulled up. So if you're looking for a job with Indian organizations like Tumbe or Astra,
Mhm.
they are paying the salaries around 8 to 10,000 dirhams. And if you're looking for jobs or career with large organizations like Cleveland or uh, UK based or US based organizations, the Gulf region, then they do pay salaries around 15 to 20,000 dirhams
Okay. Okay. Mm.
for.
Hello?
Yeah.
Yeah. I'm with you. I'm with you. I'm here.
Okay. So one can easily or so as I told you that there is a lot of scope for the EMS specialists in the Gulf region, and just to further enhance your CV, you can take up many more certifications. The most basic certificate in the healthcare informatics or the healthcare technology is certified associate in health information and management systems. It's from the most entry level certificate, but it do covers every aspect of the healthcare technology and health informatics, and even it do covers of healthcare data analysis. Uh, Furthermore, if you are looking for more specialized roles, then uh, there is there is a need for healthcare data analysis where the healthcare professionals, they will pull up lot of data in
Yes.
coming up with or to predict various diseases, and as well as to plan for the treatment plans.
Okay. Fine, sir. Fine. Thank you. Thanks a lot.
Yes, Dr. Khalid, there are a lot of courses in the Udemy too. And as I told you, that healthcare industry is rapidly growing up. And if you see the countries like USA and Canada and even various other Germany, they for each and every specialized field they have uh, they do employ a lot of professionals, and they pay a really good salaries. Any other questions?
Can I add something?
Yeah, please.
Dr. Khalid? Yeah.
Yes, Dr. Khalid.
So anyone who wants to discuss, because the questions will come into mind after the session also, they can attend MFID weekly meeting that happens at 9 a.m. and the message comes for that in both the groups of MFID. And there will be people who will try to help you out with your questions and try to guide you in your career, including experts like the one who gave the session today, our brother. And I will also be there. I'm a medical doctor. I've been into healthcare consulting since more than 15 years. I can also help. I have given my numbers and email, everything. You can always reach out to me. I can guide you how to take, without spending a lot of money on the training part or certificate part, how you can get into the field of healthcare consulting, healthcare services, healthcare IT, business analysis, data analysis, all of it, most of it I've done throughout my career, AI, ML in healthcare, a lot of things. That's all from my side.
Thank you, Dr. Khalid, and pleasure connecting with you. And inshallah, I hope everyone you so inshallah, I hope that you might have or you will make a good career in this specialized domain, and inshallah, you will do the wonders. And at last, Jazakallah khair, Saib, for giving this opportunity. Well, I will have more such webinars in the near future.